Good morning and welcome to Radio Friends. This is Wednesday, May the 6th, and I've got Dr. Smrita Dorairajan on the phone with us in the VA hospital. Good to have you, Dr. Smrita.
It's a pleasure to be on the show again. Thank you, Paul.
Yes, it's our pleasure also. Now, you are a kidney doctor, a specialist in kidneys, and you wanted to touch on today the fact that what effect salt has, or too much salt has on our kidneys, correct?
That is correct. So salt
now,
is
I wanted to ask you first.
Sodium chloride.
Sodium chloride. Do most of us take in enough salt, or do we take in too much salt?
So the problem is we take in too much salt. So for a healthy individual, the recommended sodium intake is about 2 to 2.3 grams a day, which is just 1 teaspoon, depending on which guideline you go by. But the average American diet has nearly 4.2 grams of sodium in it, which is 50% more than the recommended.
So what you're saying is the recommended amount of salt is only 1 teaspoon a day?
Yes.
Most of us, obviously, as you just said, take in a whole lot more than 1 teaspoon of salt a day.
Yes, we are. Much more than that. 50% more than what is recommended.
So what is that?
The distribution of salt, if you see what we are adding in the form of the table salt, is only about 13% in our diet. But the problem is we eat a lot of processed, packaged, canned food, which nearly contributes 60-70% of the salt intake in the average American diet. So it's not just the salt shaker that we have to watch out for, but for the hidden salt in foods.
So what you're saying is when we're eating a lot of processed food or eating a lot of canned food, commercially canned food, that's where we're getting most of our salt. What about if we're eating food that we have canned at home? There's a lot less salt in that, right?
Yes. So the goal would be to always read like food labels and always try to prepare fresh food by yourself. That way you're able to control how much salt you have added in that. But when we buy packaged or pre-processed food, it's always very salty. So here I would like to emphasize the salty sticks, as it's popularly called, because it has a lot of hidden salt in it, and people don't associate it with salt because it doesn't taste that salty. So the big six are breads and rolls. Then is the soups, the canned soups, pizza, and cold cuts and cured meats. And poultry is something we don't associate with salt, but it's injected with sodium. Poultry.
Poultry. Now you said canned
meat.
But you said canned fruit. You're saying that when we eat canned foods, but what about the canned fruit, like canned peaches? Is that high in salt also?
Yes, it is. So anything, it's better to eat it fresh. Buy fresh fruits and vegetables instead of the canned ones.
Okay. What happens to our body when we get too much salt?
So the first thing is when you eat too much salt, it also holds on to water. So it decreases the kidney's ability to excrete water. And so that causes your blood pressure to go up. And when you have high blood pressure for a long time, it leads to heart disease, stroke, and eventually kidney disease. So when you target the salt and bring down your blood pressure, then it has a whole host of benefits to your heart. It can prevent stroke, and it can prevent kidney disease too.
What percentage of our population is eating too much salt? Would you say almost 90 to 98% of the population has too much salt in their diet?
I would say that because people always go towards processed and packaged food here. So fresh options are very less in America compared to other countries. So that's why I encourage my patients, even if it's a simple meal, to prepare it and eat it fresh on their own instead of resorting to opening a box and putting it in the oven or the microwave.
So those microwave meals that we're eating, they also are packed with salt?
Yes, most of the pre-packaged food. But there are low sodium options that patients can look out for. And even healthy people should get into the habit of looking at food labels because, as I said, there is a lot of hidden salt in the food. So we have to look at the food labels. And if salt appears on the first 3 ingredients, probably it's too much salt and that food is not good for you.
Can we flush some of the salt out of our system by just drinking a lot of extra water every day?
So the kidneys do a good job of excreting the unwanted salt. But then when you put so much salt every day, it overwhelms the capacity of the kidney to get rid of it. So that is why you have to restrict the amount that you take in. The other question people ask me is, can they use salt substitutes? So the answer to that would be no, because most of the salt substitutes replace sodium with potassium. And this potassium is already a problem in people with kidney disease where they're not able to get rid of the potassium. And also, a lot of heart patients are on medications called ACE inhibitors or ARBs. And these also hold on to potassium. So we don't want a potassium substitute. But the other way you can get rid of salt is by adding a lot of herbs and spices to your food. Like lime or lemon juice, garlic,
that can
ginger.
substitute. Yeah. We're out of time, doctor, but I appreciate you visiting with us today. The bottom line is eat fresh foods, try to stay away from canned and processed foods, and we'll all be a lot healthier. Is that true?
You got it.
All right. Thank you so much for visiting with us. And if people want more information, they can check the website out at the VA hospital, right?
Yes. Thank you.
All right. Thank you very much, doctor, and you stay healthy.
You too.
Bye-bye.
Bye.